Coronaviruses are a large group of viruses. They consist of a core of genetic material surrounded by an envelope with protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, and that's how these viruses get their name. There are different types of coronaviruses that cause respiratory and sometimes gastrointestinal symptoms. Respiratory disease can range from the common cold to pneumonia, and in most people, the symptoms tend to be mild. However, there are some types of coronaviruses that can cause severe disease. These include the severe acute respiratory syndrome coronavirus, first identified in China in 2003, and the Middle East respiratory syndrome coronavirus that was first identified in Saudi Arabia in 2012. The 2019 novel coronavirus was first identified in China.
Virus has these little proteins that stick out of it, and it kind of looks like the crown of the sun.
The novel coronavirus is the name of the virus.
COVID-19, corona, VI, virus, D, disease, 2019.
In December 2019, there was a cluster of pneumonia cases in China. The virus come from. It's known that coronaviruses circulate in a range of animals. Sometimes these viruses can make the jump from animals to humans. This is called a spillover and could be due to a range of factors such as mutations in the virus or increased contact between humans and animals. For example, MERS-CoV is known to be transmitted from camels and SARS-CoV from civet cats. The animal reservoir of the 2019 novel coronavirus is not known.
Mechanism of action of coronavirus. The 2019 novel coronavirus is a newly discovered strain from the coronavirus family that causes respiratory disease. Humans have long been infected by coronavirus as it is one of those responsible for the common cold. It is a contagious viral infection spread through inhalation or ingestion of viral droplets. As a result, coughing and sneezing and touching infected surfaces are primary sources of infection. The structure of coronavirus has multiple parts. Inside the virus lies the genetic encoding that allows the virus to hijack human cells and turn them into virus factories. A protein encapsulates the genetic material known as the viral envelope. On the surface of the viron are S and HE proteins. The structure of the 2019 novel coronavirus is a mutation. For more information on this, see the link below. The large S glycoproteins are used by the virus to gain entry to human cells. They most likely attach to angiotensin-converting enzyme 2 receptors on the cell membrane, allowing the virus entry. The exact mechanism for this is not known. Most likely, as shown here, the human cell ingests the virus in a process known as endocytosis. Once inside the cytoplasm, the endosome opens to reveal the virus's genetic material, a single-stranded RNA. The virus hijacks the cell's machinery to replicate the RNA in N proteins and uses the endoplasmic reticulum to form its M protein outer layer and the all-important S protein. After replication, the virus is carried by the Golgi bodies out of the cell in a process known as exocytosis so that it can infect other cells. Meanwhile, the stress of viral production on the endoplasmic reticulum eventually leads to apoptosis, or cell death.
How is it transmitted? The exact dynamics of how the virus is transmitted is yet to be determined. In general, respiratory viruses are usually transmitted through droplets created when an infected person coughs or sneezes, or through something that has been contaminated with the virus. People most at risk of infection from the novel coronavirus are those in close contact with animals, such as live animal market workers, and those who are caring for people infected with the virus, such as family members or healthcare workers. How does the disease present? Well, from what is known so far, there can be a number of symptoms ranging from mild to severe. There can be fever and respiratory symptoms such as cough and shortness of breath. In more severe cases, there's been pneumonia, kidney failure, and death. The mortality rate is not known yet. How can we tell whether someone is infected? The infection can be diagnosed by a test called PCR, or polymerase chain reaction. This test identifies the virus based on its genetic fingerprint. There's currently no specific medication for the virus, and treatment is supportive care. There's currently no vaccine to protect against the virus. Treatment and vaccines are in development. How do we prevent transmission of the virus? This new virus currently has a limited geographic spread. However, there are a number of standard hygiene practices that have been recommended to protect against infection and further spread. These include covering your mouth and nose when coughing or sneezing with a medical mask, tissue, or flexed elbow, avoiding close contact with those who are unwell, the appropriate use of masks and personal protective equipment, especially in a healthcare setting, washing hands regularly with soap and water or alcohol-based hand rub. Actions that can be taken to prevent infection from an animal source include avoiding unnecessary unprotected contact with animals, washing hands after contact with animals or animal products, and ensuring that animal products are cooked thoroughly before they're consumed. It's important to stay home if you're feeling unwell, but if you have a fever, cough, and difficulty breathing, seek medical care early and share your previous travel history with your healthcare provider.
There are now more confirmed cases of the new coronavirus outside China than in the country. Italy now has the most COVID-19 infections outside China. The country is now under lockdown in an effort to contain the spread of the virus. But infection rates continue to soar. Thousands of new cases have been recorded over the past several days. It's not a wave, it's a tsunami, said one doctor at an intensive care unit in northern Italy, after infections nationwide jumped by nearly 3,600 on March 15th. After Italy, Spain has the second highest number of infections in Europe. It is under a nationwide lockdown for at least 2 weeks. People are barred from leaving their home unless they need food, medicine, or to go to work, if they can't do so remotely.
Nous sommes en guerre. Toute l'action du gouvernement et du Parlement doit être désormais tournée vers le combat contre l'épidémie.
The French president has also ordered people in his country to stay home for 15 days, saying any violators will be punished. And he's asking Parliament to approve a law, giving his cabinet the power to govern by decree in areas needed to manage the COVID-19 crisis. Germany currently has the third highest number of coronavirus infections in Europe. All non-essential shops, bars, religious facilities and sporting venues have been ordered closed, with no time frame on when to reopen. German citizens have also been asked to refrain from traveling abroad because of the risk they may not be able to return.
Without drastic action, cases could double every 5 or 6 days.
The United Kingdom's approach to curbing the spread of COVID-19 sharply differs from the lockdowns and border closures other European countries have adopted. People are being asked to self-isolate if anyone in their household shows symptoms of the virus, such as a persistent cough or fever, and to refrain from mass gatherings. But schools and businesses remain open, leading to critics saying the government's measures are not strict enough. Like Africa, many Latin American countries are already facing other epidemics, including measles and dengue. There are also concerns that deep-rooted social inequalities in other Latin American countries and an overall lack of investment in public healthcare put them at risk during this pandemic.
The United States, the biggest economy in the world, found itself trying to combat a contagious and deadly epidemic without enough tools to determine who is and isn't sick. And this testing shortage has caused widespread confusion throughout an already fearful American public. Even though those eligibility requirements had been removed, it's still super unclear, even today, who can get a test and who can't.
Abbott Laboratories submitted to the FDA today a request for approval of a point-of-care test.
Even though test makers like Roche are supplying hundreds of thousands of tests to labs around the country, the demand is just overwhelming.
With such a dense population, how does India plan to curb the spread of COVID-19? In a televised address to the nation on March 24th, Prime Minister Narendra Modi told 1.3 billion citizens they must stay home for 21 days. Businesses shut down and transportation grinded to a halt. On the days following, police were seen beating people with batons and publicly shaming those who were on the streets without essential reason. As the start of April, India has recorded more than 2,000 cases of COVID-19.
On Independence Day, Prime Minister Sheikh Hasina said Bangladesh had courageously faced down past dangers. We won our war of independence, she said, and coronavirus is a war too. We will win again. Inshallah. The mass prayer event triggered alarm. The true extent of infection in Bangladesh is unknown. An attempted national lockdown has left already impoverished people jobless, hungry, increasingly desperate and dependent on handouts. With experts warning that only the immediate implementation of aggressive countermeasures can avert what they call unimaginable damage, the government's deployed troops to enforce social distancing, streets sprayed with disinfectant. A senior Bangladeshi doctor, insisting on anonymity, told Channel 4 News they'd done what they could to prepare, but resources are limited. Our people are not aware of the danger, he said. If there is mass infection, our health system will be totally devastated. Coral Slum, Dhaka, a vast, tin-roofed shanty. The government is distributing food to the poor and has offered emergency support to 4 million Bangladeshis in the garment sector, many of whom now face destitution after global clothing brands cancelled £2.5 billion worth of orders, including several leading British retailers. The Garment Manufacturers Association has appealed to fashion firms to honour contracts. Only a handful of firms have said they will pay for existing orders. In the far south of one of the world's most densely populated countries, the world's biggest refugee camp, crammed with over 1 million Rohingya Muslims who fled ethnic cleansing in next-door Burma. Many live 12 or more to a room in bamboo and plastic shacks, a density 4 times that of high-rise New York City. Prime conditions for corona, which thrives in confined spaces, threatening to turn crisis into catastrophe. Loudspeakers mounted on auto rickshaws broadcast COVID-19 warnings and public health advice. Mobile networks and the internet have long been curtailed in these camps by the government on unspecified security grounds, so volunteers have resorted to spreading the message by megaphone. Death stalked the Rohingya people in the pre-corona era. They're used to it. They're resilient but very vulnerable and hopelessly ill-equipped to cope if, or more likely when, COVID-19 strikes.